Yeah, I think the most important thing is that we have no significant differences with the aims that SNAG has. I always say when I'm asked about environment, and I say the same when I talk about disability, that you can always do more. I don't think it's fair to say that there's been no progress whatsoever. I can look back through the years, for example, at St. Martin's School, which I know they've been very involved in, and now we've got an excellent relationship with the Parents Association and with SNAG as well, who also have an interest in this. We've developed that tremendously, and there have been progress in other areas. I think what perhaps was unfortunate is that just a couple of days after we'd held what I thought was a very productive meeting, there should be a press release saying that there's utter dismay at progress. This was not the mood that came across in the discussion. And therefore I think that is what made us respond, because it could have given the impression that we either didn't care, which we certainly do, or we weren't listening, which we certainly are.
A number of issues highlighted by SNAG, but one of the things that it points out is that improvements should be on provisions and services, and the government should not rely so much on charities and NGOs.
Well, I don't agree. I used to head an NGO, as you well know, and around the world, NGOs are prolific in the professional way in which they run a lot of things. And many of the big international initiatives are from NGOs. And there's a huge role in NGOs. In Gibraltar, we have Cancer Relief, does a wonderful job with the Cancer Centre. We have Childline, we have Clubhouse and the great work they do on mental health. And now we have the new one that's starting now, Possibilities, who are going to be working a lot in this sort of area. So I think it does a disservice to NGO, and SNAG is an NGO, to question their ability to deliver, because it's proven ability to deliver. It's got to be a partnership, and certainly the government will be there and is there in supporting the work of these NGOs.
Is it a question of cash flow? Because there are things the group claims have been removed, like one-to-one therapy and respite services at St. Bernadette's.
I wouldn't say that at this stage. Certainly there's progress to be made. I believe that there are plans already through the care agency to try and provide overnight respite. I think a certain amount is done during the day, and these are all things that we want to achieve. And certainly the plans that SNAG have presented are very exciting, and we agreed at the end of the meeting, I think it was on Thursday, that there's work to do on both sides. They had to develop their ideas, which is why we said we look forward to more information, and we have to consider their requests and their suggestions on providing a facility, as I say, very exciting plans, and we undertook to take them away, look at costs which haven't yet been identified, and see how we can make progress.
Finally, Dr. Cortes, a group claiming that young adults are being failed by the system because of the lack of provisions on further education.
Yes, there's progress to be made there. I do agree that once children leave St. Martin's School, they're not looked after in the way that we would all like them to be looked after. It's not that they're not looked after at all, but we can improve the facility in which they are. Already the Gibraltar College is moving in that direction and is providing some support. I think they are one of the entities that can do a lot more, and we're looking to expand that. But I think that looking after the 16 to 25-year-old has to be a priority, and we are looking at ways of doing this.